Hello everyone. In this video, I will talk about osteochondroma, which is a benign bone tumor. Osteochondroma is the most common benign tumor of the bone, but it is not a true tumor. It is a developmental malformation or aberration from the growth plate. So, what happens is there's a few cells from the growth plate. I haven't drawn the growth plate here, but it will be around this place. A few cells from the growth plate, they start growing centrifugally, as you can see over here. A few cells will start growing centrifugally, that is away from the bone, and that is how this tumor arises. But the tumor stops to grow once the growth plate is closed. So once this growth plate will be closed, this will not enlarge anymore, the cells will not grow anymore. It could either be sessile or pedunculated. If you look at the location, the most common part of bone which it is seen in is the metaphysis. Now, if you look at the structure, it consists of a bony pedicle and a cap which is made out of cartilage. So, this is the bone part, this pedicle is the bone part which comes directly from the growth plate, and this cap over here will be made out of cartilage. Now, if you look at the clinical features, the most common age affected will be an adolescent child. So, there will be an adolescent child complaining of a painless swelling around the knee. The child will complain of a painless swelling around the knee. The knee is the most common joint involved. Now, there is a painless swelling, but there might be multiple of these swellings if there is a condition called exostosis present. So, there's a condition, exostosis. If that is present, then there are multiple of these painless swellings present in multiple bones. And whatever bones they are involved in, there will be a limitation of movements around the joints of that bones because of the swelling. Now, the swelling can lead to bursitis, because of which the patient may complain of pain, or it because of this outgrowth, it may cause compression of the surrounding neurovascular structures, and so that is also a clinical feature, compression of the neurovascular structures. How will we diagnose this? By X-ray. So on X-ray, there will be a bony pedicle which is seen, and this bone is made out of mature cortical bone and marrow. So it has bone as well as marrow inside it. It has both. But on X-ray, the cap will not be visible. Since the cap is cartilaginous, it will not be visible on an X-ray. Treatment is by excision after skeletal maturity. So excision has to be done after skeletal maturity, because if it is done before skeletal maturity, the growth plate will not have closed yet, and the tumor will just keep growing. Like I showed you over here, the tumor will just keep growing. It's a growth from the growth plate. So if it has not grown yet, the cells will divide again and it will start to grow again. So once the growth plate has closed, that is when an excision of the tumor is performed after bringing it to a maximum size. Now, if you look at the prognosis, it is a highly recurrent tumor, and it can undergo a malignant transformation and form a chondrosarcoma. Now, the signs of malignant transformation are very important. They are a very important question. So malignant transformation is seen when cap size is more than 2 centimeters on MRI. So if we do an MRI and the cap size is more than 2 centimeters, then it may indicate a malignant transformation. Or on X-ray, the cap appears calcified. So as I mentioned, the cap is not usually seen on an X-ray, but if it is seen and it is appearing as calcified, then it indicates a malignant transformation. And if the tumor is growing even after skeletal maturity, usually it stops after skeletal maturity, but if it is growing even after skeletal maturity, then it indicates a malignant transformation.